Hello and welcome back to Urology for Everyone podcast. This is Dr. Girish Nelivigi, Urologist and Andrologist with you. In today's podcast episode, I am going to talk about urinary tract infections. Urinary tract infections are one of the most common infections afflicting both males and females. The urinary tract consists of kidneys, ureters, urinary bladder, prostate, and the urethra, and any of these organs can be involved. Infection of the kidney is called pyelonephritis, infection of the bladder is called cystitis, infection of the prostate is called prostatitis, and infection of the urethra is urethritis. They can occur in any age, but certain age groups are more predisposed. In males, the most common age group is in the elderly, which is after the age of 50. This is the age in which prostate enlargement is seen and is responsible for urinary infections. In the females, there is bimodal distribution with a surge in infections, with the first surge occurring after the onset of sexual intercourse and after marriage. This goes by the name of honeymoon cystitis. The second surge in the females is in their 40s and 50s with the onset of menopause, where hormonal changes at menopause increase the incidence of urinary infections. Urinary infections are seen in children also, where they could be associated with congenital abnormalities of the urinary tract like obstruction to the kidney, peuge obstruction, vesico-ureteric reflux, megaureter, posterior urethral valves, etc. The most troublesome infections are seen in females where they could be recurrent. This leads to a situation where some suffer from urine infections regularly despite antibiotics. Now, what are the symptoms of urinary infection? The most common symptom is burning urination, also called dysuria. The next most common symptom is increased urinary frequency, where the patient has to visit the toilet very often in both day and night. This could be associated with urgency in urination, where the patient has to rush to the toilet, and sometimes there could be leakage of urine also. The other common symptom is a pain in the lower abdomen and low backache. The patient may feel feverish and fatigued, but usually in the infections of the urinary bladder, the fever is low grade, whereas in infections of the kidneys, the fever is high grade and associated with chills. Now, when you go to the urologist, how is a diagnosis of urinary infection made? Urine examination is the most important test. It is a simple and affordable test which can give a diagnosis in a few minutes. The doctor can start the treatment immediately. Urine can be sent for culture and sensitivity, but the results will be ready only after 3 days. Some simple blood tests like complete blood count can establish if the urine infection has spread to the bloodstreams. In complicated infections, an ultrasound abdomen will help in finding out if any other abnormality is present. Depending upon the complexity of the infection, more tests like CT scan may be needed, which will be decided by the treating doctor. Now, how do we treat urinary infection? The mainstay of the treatment is antibiotics. Most of the times, oral antibiotics are enough. However, in severe infections, injection antibiotics are needed. In case it is very severe, the patient may need hospitalization for observation and treatment. The antibiotics have to be taken for a minimum of 3 days, and in severe infection may need to be continued for 15 days. Adequate rest is important, and ensuring good oral hydration is also important. There are many supportive treatments like cranberry juice extracts, which come as capsules, and also alkaline solutions which come in liquid form. Alkaline solutions are very popular and help in reducing the acidity of urine so that burning sensation may decrease. Cranberry capsules may help in long-term prevention of infection, but the evidence that they work is not very strong. So thank you so much for listening, and it's me, Dr. Girish Nelivigi, signing off. See you again in our next episode.